Hello everyone, hope you're doing well. This week we're going to really dig into Chapter 9 again. So we're on the Flatworld textbook, and it's Chapter 9, in which we talk about more health communication. There's a lot of great information on the ebook that I don't know if everyone realizes because, of course, you have the hard textbook as well. But there's some really cool information in here, and let's start by looking at Chapter 9, Section 3, Health Communication and Relationships. Of course, we're talking about provider-patient communication in this section, and it's really important for the provider and the patient to have excellent communication. I know of some primary care providers, of course, that have had the same patients in their panel, for 20 to 30 years, and they've really taken care of these people through challenging parts of their life. And patients, of course, feel comfortable with that kind of relationship. So if you build those relationships with patients, and I know not every relationship in the healthcare setting is going to last 30 years, they might just come into the ED for a quick visit. They might come into the immediate care for a cold or a cough, but that relationship that you have is really, really important because the interaction and the trust that you build can lead to, of course, someone getting sick or someone getting better. So that's an important step. But I wanted to scroll down a little bit and talk about caregiving. Caregiving is an important part of health communication, and it has been studied throughout the lens using theories of social exchange theory. So this talks about caregiving from the perspective of as people age, and especially the baby boomers, as people age into the need for having long-term healthcare settings. That can mean long-term care, of course, for some people, maybe home care, for others, maybe assisted living. And I know that a lot of you are aware of the different requirements out there that people might need, but there's a really interesting take on caregiving, and there's a really great video in here that I want you to watch. It's shared via YouTube, and it's attached to 9.3. I can't actually play it on my lecture here because it won't show sound, but there's a lot of great information in there, and it shows you kind of a day in the life of a caregiver. And I think this is going to be a trend as healthcare moves into this direction. People are living longer, and of course people need extra help as they continue to live longer, and we're going to get, I think, a rise in healthcare caregiving need. So you're going to see a lot more long-term care facilities pop up, a lot more assisted living. You can already tell. I know in the area that I live personally, there's assisted living facilities popping up, every year. So it's going to be a high need. Make sure you know about caregiving. I think we're all going to have more information about that as time goes on. So getting a jump start on knowing how to, of course, communicate effectively when you're a caregiver is very, very important. All right, let's scroll down and talk a little bit more about the information in health communication competence. So we're going to move into section 9.4. So I want you to concentrate on section 9.3 and 9.4 for this chapter. And again, we're concentrating on the last two parts of the chapter because we've already done a lecture of the PowerPoint per se, but health communication competence is something that I think we all need to be aware of, especially from the perspective of AI. AI, I don't think is specifically mentioned last time I read it in this chapter, but it's a new trend. A lot of people can get AI information that really gauges healthcare need, and it can often be accurate and sometimes it's not. So we've kind of transitioned from some of the information that's said on here with health information seeking, like people going to WebMD, to people asking AI. They'll list out their symptoms and, hey, what kind of challenge do I have? What kind of sickness do I have? And it'll tell them something based on an algorithm. And that can be really dangerous because patients can, of course, not be treated for certain things, and the information that they were given via maybe AI, or if they're information seeking from WebMD or something, might be incorrect. So there is a challenge out there, and when we communicate to patients, I think we need to make sure that we are able to convey that information in a very clear and concise manner. But WebMD has been used for years, and we want to make sure that people understand that, of course, there's some great information on there. Sometimes it's accurate, but there's some information in there sometimes that can lead to wrong diagnosis. So keep that in mind. Google is not a doctor, so we need to, give people the credit that when they go to school, these providers go to school, they're educated to help us, understand our healthcare needs from that perspective, and there's challenges there. So keep that in mind. What I really want to concentrate on for this module is, health literacy is getting competent. So knowing your craft, and you're going to hear a lot of information out there in society today about health literacy from the perspective of, like we talked about, people being able to access health information just by going online. However, it's up to us to make sure that we continue to study and we continue to improve our craft, and we know, based on, of course, evaluatory needs, what we're able to confer to patients. So getting competent, I know, can be a variable thing, depending on what kind of specialty you're in or what type of thing you practice, or what type of practice that you have. Providers, of course, need to remain competent by continuing to get continuing education credits, to maintain their license, and continuing to go to different conferences and such to keep their skills up. Skills practice for clinical providers, those that are in clinical practice, maybe in the surgical setting, you need to keep up your surgical practice and do a certain amount a year to maintain competence. And I'll give you a story about that. We actually had some challenges when I worked in Alaska. Our OB unit only delivered about 30 to 40 babies a year. And we did have providers that went through these deliveries. However, 30 to 40 a year split between 3 or 4 providers is really not enough to maintain skills. And there was a concern that these providers would continue to have challenges or might have negative consequences for the patient if they didn't maintain these skills, of course. So we had the choice: could we potentially send these providers away for a few weeks out of the year, pay for their trip to have these skills used, maybe at another hospital where they did a lot more deliveries, or did we shut down the program due to risk? And we ended up shutting down the program due to risk, which was challenging for the community because we were one of the only healthcare providers to deliver in that area. However, there was another hospital that also did this. But from that perspective, we just didn't do enough to maintain our competence. And that's something that we need to all evaluate. Whether you're in administration or you're in clinical settings, you need to make sure you do what's needed to continue to grow and to continue to learn, because healthcare changes every year. It changes actually, all the time. It doesn't have to be every year. It changes, day by day. So we need to keep up with that, and it's important that we maintain our skills. For me, in the administration side of things, I of course have to continue my, uptake of information from the perspective of going to school, learn how to communicate more effectively. I learn more efficient ways to manage finance. There's a lot of different things that I look into from the perspective of competence. So keep that in mind. I just want us to continue to grow, and that's what this really outlines: health competence. So this is going to talk a little bit more about health literacy basics for patients. I think it's really important that you watch this video as well. Lots of great information here, and this of course is in chapter 9, and we're in section 0.4. Media and health, there's some great information in there as well. I'm not going to really spend a lot of time on that. And then we're going to scroll down and have one more section that we talk about. And I know we've had a lot of information in these last 8 or so minutes, but understanding health communication across the lifespan is really important. We talked about caregiving earlier. More people are starting to age where they need full-time caregiving or part-time caregiving. We talked about assisted livings and long-term care is popping up everywhere. Some people might want to even age at home. That's another thing that you're going to see a lot more of due to the baby boomer growth. But understanding health communication across the lifespan is really important, and understanding those patients that might have challenges with their own health literacy is also important. There's going to be changes as people go through gains and losses in the lifespan, and this talks about from birth to death. We change in positive and negative ways. You're going to have challenges, of course, with lack of competency, maybe as people age up, and there's changes. As healthcare providers, we need to be able to communicate with people as they go through these changes, and it's up to us to recognize, maybe that patient coming in might not understand our directions to them at first, but if we repeat ourselves in a calm and compassionate manner, they're going to be able to understand it, and we're going to help them and communicate where they're at. And that's my main piece of advice. Make sure you communicate with patients where they're at, and not, of course, based on your knowledge. Because I see this a lot in healthcare, and I have a lot of complaints from patients because a lot of times a provider will walk in the room and communicate on a very high level, and a patient will not understand their diagnosis or the directions the provider is trying to provide them. We need to communicate on the patient's level. That's our job, and that's really important for us. So, in the end, if we communicate on their level, they're better understanding. There's better understanding of the message that we're trying to provide, and of course, they're going to be happier and healthier as a result of it. That's really all that we're going to talk about for this week. We had another overview of Chapter 9. I think it's really important. So we did 2 parts, health communication and relationships and health communication competence. From that perspective, I kind of segued a little bit with some stories. I hope that was enjoyable, but make sure you review Chapter 9 again. Again, this is the second time reviewing it, and I thought we needed to review it twice because it's so important. And this is really what health communication is all about, making sure we maintain an effective process with our patients and making sure that they understand what we're trying to convey. If you have any questions, don't hesitate to reach out. I'm happy to help, and I'm looking forward to the next couple of weeks as we start to wrap up this semester.